When you're talking about, first of all, professional athletes with millions of dollars on the line, of course there is that pressure to perform and to be at the top of your game. When it comes to things like the Olympics, for example, where seconds and milliseconds count, can be the difference between, winning a race and getting on the podium or not. There is certainly that incentive. And of course the peer pressure, because if you think that other athletes are doing it, then there's always that temptation to not fall behind and do it yourself.
All right. How easy would you say it is for an athlete to cheat on the test?
Well, there are a number of ways that athletes can use performance-enhancing drugs and get around the tests. So perhaps the simplest, most straightforward way is to use performance-enhancing drugs at a time early enough that by the time they are subject to these random tests, the drugs have already washed out of their systems. Another approach, of course, is to use other drugs to mask the drugs that are not allowed to be used. And then the third thing that happens is, of course, the laboratories that develop these medications and drugs and aids may actually, when they develop a new type of performance-enhancing drug, there may be no test to detect it. So if they can stay ahead of the testers, then athletes can get away with it.
So these drugs, they have a lot of side effects, including psychological ones. So do you have some examples of what those side effects are?
Well, sure. Those are the ones maybe we don't talk about as much because obviously we know, things like steroids can lead to cancer in some cases, heart disease, and so on. But psychologically, you've heard of roid rage, right? That expression where people who take steroids sometimes fly into these angry rages, violent rages. So aggressive behavior can be a side effect of taking testosterone or, steroids. You may also have that sort of lability or instability of mood. So mood swings are quite common. And then, of course, for some people, it can sort of lead you down into the pit of depression. So because some of these drugs interfere with hormonal function, it can be so closely tied with a person's mood.
It sounds like the Incredible Hulk, really. What are the lifelong effects, though, of prolonged use of performance-enhancing drugs when you use them all the time?
Well, the problem is that, let's take, for example, something like EPO, which is a drug, a hormone, that people can take artificially to increase the number of red blood cells circulating in their systems. Now, this is good because it increases the amount of oxygen that gets to the tissue and can lead to higher performance. But the problem is that the more densely packed your blood is with cells, the thicker it is. So the harder it is to pass through blood vessels, and that can lead to strokes and heart attacks and other blood clots. We also know, as we said earlier, that things like hormonal performance-enhancing drugs like steroids can lead to problems with the liver, problems with the kidney. In rare cases, it can lead to liver cancer. And so, there are these sort of chronic diseases that can come from using these drugs.